everybody. Dr. Rob DiMartino with Superior Health Solutions, back again for part 2 on the autoimmune disease conditions. Looking over now what we want to do with this video. If you missed part 1, please go back and watch it. It's going to talk about what your immune system does for you, why this is such a paramount of importance thing, and how this is really becoming a plight on our society where this is causing us all these different kind of issues. And if you have symptoms that you can't figure out, there's a real good chance that it's probably because your immune system has gone haywire and it's starting to attack your own body, which is a bad place to be. So part 1's up there for you to watch. This one's about part 2. This is about actionable steps, what we do. Everyone asks me, what do you do? How do you do this? And the reality of it is this is a template. Everyone's going to be a little bit different. We've gotten a lot of people well just by basically following along with this straight up and down strategy. But I know you don't want to hear this, but the first part of this is always specific testing. Specific testing done for what people will look at when you have an autoimmune issue. Balances of immune system, different inflammatory markers and chemicals going on that you may have had done, but I'm going to tell you in my experience, most of you haven't had it done if you're still dealing with this kind of problem. And, also being said, this is not to rag on anybody, this is not to put anybody down, but it's about truth and consequences here. So if we're going to deal with this from a strict medical perspective, again, we're coming at this from a completely natural, holistic, functional medicine type of an approach. If you're going to come at this from a medical perspective, what we've got in medicine right now is medications and drugs and pharmaceuticals that are designed to suppress the immune system reaction. So the concept here is your immune system is damaging your own body. Utilize this medication to make it weaker so it's less efficient at doing that. Okay, that's fine for maybe a short-term type of usage, but you can't be on that kind of immune system suppressant for a long period of time because, again, you kind of need your immune system to keep working on and on. Nothing wrong with that to jump in and save somebody in an acute situation, but then after that, you better start rolling up your sleeves and looking for real alternatives and real solutions long-term to be able to get this back to normal. And anytime we deal with immunities, we talk there's 3 steps. You have normal immunity, you have benign autoimmunity, which is what people typically refer to as remission. And then you have pathological autoimmunity. This is where you're having symptoms. The body is being affected. It's taking damage. That's where most people present, and that's where we do not want to be. We will always go and try to reverse and reset everybody back to a normal immunity. But I got to tell you, if you get to benign autoimmunity, where it's there, it's in remission, it's not affecting you, and all you have to do is to watch that and make sure it stays that way, you're going to be a real happy camper, and we're going to dance a jig because that's going to be a really important thing for us to be able to achieve health-wise for you that, up until not that long ago, it just wasn't really there for us. So the step process that we'll go through here, again, is a general kind of overview, but it helps to give you some sort of baseline of how we're going to go about tackling this. So we're going to use our trusty whiteboard here, and we're going to do number one. Number 1 is always about building energy, okay? Setting the body up for success. And I've got to tell you, everyone always asks me, what's the culprit, what's the cause of all this sorts of stuff, and there's no one arch villain that causes it all. Hopefully that's what this will diagram when we get through 10 steps here. What we'll diagram from an autoimmunity perspective is this is a complex set of co-problems that will come together to create one bigger issue that we've termed autoimmunity. What tissue it affects is just happenstance. It's wherever that offending agent ends up, and we'll get into that. But the reality of it is if you put me in a corner and you put a gun to my head and say, name one thing, I'm going to tell you that the biggest thing is that the body gets so starved for energy and so disconnected from itself that eventually that energy starvation sends everything into haywire and your immune system is just trying to get you out of that trouble. So building energy, getting better sleep goes into this as well too. I mean, who really wouldn't want to get more energy and sleep better anyways, but it's a founding thing. It's almost like building you up before we start rolling up the sleeves and getting in there and start breaking stuff down. So then secondarily too, in the concept of that, getting the detox pathways up and running to make sure that your body can get all of this junk out. Making sure that your liver, your kidneys, your gallbladder, your spleen, all of those things are going to be able to handle to get this push done and get all of this junk out of your system and well, for good. So then thirdly, this is all about balancing pH. So when we talk about this, I'm not even so much talking about stomach acid or things like that. We're talking about the pH, the acidity, alkaline balances of your entire body. There's a world of people out there talking about this is all that you need to do. I'll respectfully disagree with that, but I will agree with it's a really important baseline step to have in place to make sure that this doesn't create a consistent problem. And we get so many people who come into us that'll say, I've been doing this alkaline diet, or anti-inflammatory diet, whatever you want to call it, and I can't seem to get my pH to normalize. That's because they have so much offending infections and toxicity issues inside of the system. That's going to screw them up over the course of time, and it's going to take them a much longer period of time to get their pH levels reset. So, in that kind of factor, we want to get in here and we want to start talking about, removing things like infections. Searching out and making sure we remove infections. Or, also removing heavy metals or any kind of toxins at this point. Obviously you have to identify these things, figure out what they are. From a toxin standpoint, we also talk about food allergies as being toxic to your system, and really more so food sensitivities. That IgE scratch test that they do on your back is not going to tell you the whole story. That'll tell you if you go anaphylactic, but not the whole story. And then the removing infections, we also talk about the hormone balances, where your body can stay in a hormonally imbalanced state and cause your immune system to go a little bit haywire. Finding this chunk out is the biggest idea, because you got to get out whatever's creating the reaction in order to reset things. Then once you do that, then you can have the conversation of, doing things to reduce inflammation. Inflammation's gotten a bad rap. It's like the cause of all human health problems. It's just a reaction to these things. Your body's trying to save itself, trying to sacrifice a part for the whole. But once we can get those things lessened or neutralized or out of your system, then the inflammatory reaction becomes unnecessary. Your body will shut it off. The faster we shut it off, the more symptom relief we get, and the faster we can move back to a benign or hopefully a normal immunity overall. That's why it's so important to measure these specific autoimmune factors when you're looking at an inflammation perspective of what you want it to do. Number 7, and this is huge, 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 it's healing the gut. Because depending on the research you read, 80% of your immune system regulation occurs in your gut, in your stomach. That's where food allergies get into a part of this. But making sure you get out any offending bad things in there, infections, food rotting, gluten, whatever the case may be. Making sure that you heal that gut lining, and then making sure you re-inoculate with the good bacteria. Please, please, please don't go out there and just take probiotics forever. It's not the right way of doing this. It's a step-by-step process you have to follow with this, and if you do it right, your gut will be better. You'll notice your digestion's better, but it will make a huge difference in healing this for long term when your gut is healthy and functioning normally. It's a really important step. Once we get back into the gut, then that allows us to start really getting into this and then balancing out the immune system. So balancing out that Th1, Th2 reaction that we talked about in video 1, whether we're invading or whether we're stuck. And by the way, pretty much every single cancer is a Th2 dominant system. So Th1 dominant brings us to a lot of autoimmune. Most autoimmune diseases are here. Lupus starts to creep over towards Th2. It's why you start to see a huge relationship between lupus patients and cancer going on inside of their bodies. But Th2, if you're dealing with a cancer, Th2 dominance is an issue, kind of a similar concept here to deal with some cancers from getting yourself well naturally. And this is a trick to do. I mean, there's a lot to do. I mean, it sounds really super easy, but there's a lot of different components that go into trying to resolve that, get something like that back into managed states. Obviously, number 9, we want to build up the wall to make sure this doesn't happen again, and that's with antioxidants. Antioxidants preserve, pretty much there's no autoimmune patient who doesn't have an issue with low antioxidants. This preserves the balance. This helps to keep cells that need to go, go. Cell that needs to stay, stay. The reaction of creating energy. But this builds up a fortress wall so that this will not happen again. And then level 10 down here specifically is supporting individual tissue. And it seems odd that this would be all the way down here, and sometimes you don't even need to do this, but so say it's a Hashimoto's thyroiditis, an autoimmune disease of the thyroid. Here's where you're going to start specifically looking at trying to hope and function with the thyroid. Because remember, in an autoimmune, even for something like a thyroid, thyroid's not the problem. Your immune system is beating your thyroid up and then causing symptoms of low or high thyroid, typically low. So your immune system is bullying your thyroid function, so trying to just fix your thyroid or throwing medications at your thyroid is not going to get you very far. You'll get that honeymoon stage where you feel a little bit better, but you're going to miss that bigger, deeper line of what's going on in these first 9 steps, which is where we really want to focus. So a quick 10-step process to get you the idea of where we have to start off with this. Obviously, this is all tailored to the individual. Doing nothing but this and knowing nothing but this puts you way ahead of the game when it comes to dealing with autoimmune diseases. I hope this helps.